Dr. Aditi,
Hi.
my doctor has told me I have some pelvic floor issues.
Okay.
Can you please tell me about what pelvic floor muscles are?
It's a very good question. If you are also curious to know more about your pelvic floor muscles, then watch this video. Your pelvic floor muscles played a very important role during your pregnancy to take care of your baby. It was holding it, protecting it, and doing whatever it had to do during the time of your pregnancy. It had undergone a lot of strain and stresses. So are you actually curious to know about your pelvic floor muscles? And I think you should be able to understand more about your pelvic floor muscles because it will help you in healing and recovery during your postpartum time. So this is your pelvis, a female pelvis which has all the organs of the female reproductive system. Like you have your uterus, fallopian tubes, ovaries and the bladder right in front of it. But where is the pelvic floor muscle here? It is right underneath your pelvis. It is holding everything in the pelvis and in your abdominal cavity. So this is your pelvic floor muscle. This muscle is actually known as a trampoline kind of a muscle because it is when you bounce on a trampoline, it bounces and comes back, bounces and comes back. Same thing your pelvic floor muscle does, and during your pregnancy, same thing it was doing. It was nicely taking the load of the baby, taking the load of that amniotic fluid, taking the load of excess fat around your belly. Yes. Now, when we look at the pelvic floor muscles, you'll see that they are attached in the front on the pubic bone in the front. So this is your pubic bone. These are the crest of your pelvis. Yes. And in the center, they are attached to the pubic bone right here. Now, at the back, you have the tailbone. The tailbone is the end part of your spine. So your pelvic floor is attached right from the center on the pubic bone to the back at the tailbone. And on side to side, this is attached to the sits bone. Sits bone are the bones where you sit and take the weight of your body when you are sitting. Yes. So if you see, it has 4 attachments down, and this muscle is actually formed in layers. So this is the most superficial layer, and if you see inside, if you removed all the organs, that would be the deeper layer. Now, every layer of this muscle has different functions, but in nutshell, this muscle specifically supports and holds all the pelvic and abdominal contents. Now, next, the functions of your pelvic floor are to maintain the integrity of all these sphincters. So, you have the urethra, you have the vaginal sphincter and the anal sphincter, right? So, it maintains the integrity of all these sphincters, means it is very important for your bladder and bowel functions, and also to maintain the integrity of your vaginal muscles, to contract and relax nicely, to have nice fluids and lubrications around. This muscle is also forms the part of our core canister. Strong core means that your inner core muscles are taking care of you when you are lifting, jumping, coughing, jumping with your child maybe on the trampoline, or lifting grocery bags, or you are trekking, mountaineering, anything you want to do. So this specific muscle maintains the core and stabilize the core with other core muscles of the body, like your inner core, which is transversus abdominis, low back inner muscles are your multifidi muscles, and a very important muscle here is your diaphragm, which is also the part of this core canister. Yes. And very important, the last part here, that this muscle, pelvic floor muscle, breathes with the diaphragm. Yes, you heard me right. So the breathing muscle is the diaphragm, but when your diaphragm is contracting and relaxing to allow the chest expansion and the lung expansion, pelvic floor muscle works along with that. So this muscle has actually gone through a lot during your pregnancy. The breathing muscle, your diaphragm was not working properly, so pelvic floor muscles are not working properly. Pelvic floor muscle lengthened. So according to the books, we say that 2.5 centimeters to 3 centimeters lengthening of pelvic floor muscle should be okay. And when it has actually lengthened, each and every fiber of the muscle were so tensed and taut to hold the weight of the baby. Now, you are somewhere in your 6 weeks postpartum, and now let's talk about how to heal this muscle, how to relax this muscle, how to revive this muscle. I hope you must be having some clarity now on your pelvic floor muscles, right?
Yes, doctor, but what about the pelvic floor exercises?
You also want to know? Then wait for the next video. Until then, subscribe to Momfirst YouTube channel. Stay tuned and do not forget to press the bell icon so that you can get all the notifications about all the videos. And yes, share this video and all the other videos and about the channel with your friends and family. Till then, take care, stay healthy, keep exercising.